So what is the oral surveillance study and how can it be applied to our clinical practice? The oral surveillance study was a randomized, open-label, non-inferiority, post-authorization safety endpoint trial. It involved patients with active rheumatoid arthritis who were 15 years of age or older and had at least one additional cardiovascular risk factor. Patients in the study were assigned in a 1:1:1 ratio to receive either Tofacitinib at doses of 5 or 10 milligrams twice daily, or a TNF inhibitor. The co-primary endpoints were major adverse cardiovascular events such as MACE and cancers excluding non-melanoma skin cancer. During a median follow-up of 4 years, it was observed that the incidences of MACE and cancers were higher in patients receiving the combined doses of Tofacitinib compared to those receiving a TNF inhibitor. Specifically, the incidence of MACE was 3.4% in the Tofacitinib group versus 2.5% in the TNF inhibitor group, with a hazard ratio of 1.33 or 95% confidence interval, indicating that non-inferiority was not shown. Similarly, the incidence of cancers was 4.2% in the Tofacitinib group compared to 2.9% in the TNF inhibitor group. The study concluded that Tofacitinib was associated with higher risk of MACE and cancers compared to TNF inhibitors, particularly in patients age 65 and older. The increased risk of adverse events with Tofacitinib raises significant safety concerns, causing the FDA to extrapolate the study's findings beyond Tofacitinib to all JAK inhibitors and restrict the use of this class of drug to patients with RA only after a first TNF inhibitor failure. This decision was met with some scrutiny, given the external validity of the oral surveillance trial is limited, given only a single JAK inhibitor was evaluated, and as previous speakers have mentioned, there are JAK receptor potency differences between molecules that suggest theoretical safety benefit to JAK1 selective agents such as upadacitinib. That said, clinicians like us would be wise to follow the FDA guidelines until studies comparing JAK inhibitors with one another and other biologic DMARDs beyond TNF inhibitors are conducted. Thanks so much for listening. For more information on this topic and others, please visit the RAP website, Content Room, for more.